Here at Chips Dental, we do really believe that everybody wants to have a great smile. And I came up with this idea, well, you know, we do give some dental care away on occasion to people who are in need and whatnot. What if we found a deserving individual and we're able to give away a smile makeover and have a lot of fun with that? So we partnered with the lab, Maverick Dental Labs, and 3 of my specialist friends, a periodontist, Dr. Jim Workmeister, and the orthodontist group, which is King Orthodontics, and an endodontist, Dr. Greg Semeshko. And in the end, the case did not require an endodontist, but he was still part of the decision-making process and really involved up until treatment began. So we came up with this plan, and we were going to launch this through our Facebook account. And so they had to submit their application, they had to write an essay, and we wanted to know how a smile makeover would change their life.
How would a smile makeover change my life? Well, no woman likes to be asked about her age, mostly because she doesn't want someone to think of her as old. Looking at yourself in the mirror correlates a great deal with your self-confidence. You could be smart and talented, but still have doubts about yourself in the back of your mind based on how you look. Unfortunately, this is the case for me. Everyone wants to feel young and beautiful. That's why I cringe every time someone in my daughter's 4th grade class mistakes me for her grandmother. On multiple occasions, parents and kids have asked me if I'm my daughter's grandma. I am married with 3 children. They all have charming smiles, and I wish I had one to match. I avoid family pictures because I'm scared of what people will think of my smile. And at this point, I feel like getting what I truly want done to my teeth is too expensive. I would greatly appreciate the opportunity to have a smile makeover. Winning this would help me to reach my full potential due to the overwhelming confidence and self-assurance that I would gain. Please vote for me.
And how we came to a winner, they had to go out and solicit votes. They had to actually have their friends, their family, people they knew, they had to ask them to vote for their case on the website, and the people with the most votes would be submitted to the panel. The judging panel included myself, the other specialists. I think we included the lab on that as well. And we all worked together to decide who was our best candidate. And so we ended up deciding that Lisa's case was going to have a really dramatic result. And so we all came up with a treatment plan together. And what we did first was there were some areas in the gums, that was where Dr. Jim Workmeister came into play. And there were some areas of her gums where the healthier part of the gums were not strong enough to withstand normal orthodontic care. And so Dr. Workmeister did a series of grafts to make that gum architecture ideal for orthodontic care.
Excellent. Everything looks very good.
After that it healed, she went ahead into King Orthodontics. In their orthodontic group, they repositioned the teeth so that smile makeover could be executed in a minimally invasive way.
And they put the braces on. I have like clear on the top and silver on the bottom. And it's been 1 year now that I've had them on, and they told me 2 more visits, they'll be coming off. So yay. Yay.
Oh my God. Wow, that's crazy. Very nice.
Okay, so on to the next part of this process, the cosmetic work, now that everything's lined up real well.
After the work had been done, after the grafts and the orthodontics had been complete, her smile was in a perfect position to be redone. Everything's been set up for success here. Thanks to Dr. King. So we decided with Lisa that to establish our final result, our final smile makeover, we were going to do veneers. And so veneers, or ceramic porcelain veneers, they are we call it indirectly fabricated. It means that I prepare everything in my office in the chair and you know, under local anesthesia, she's numb, we prepare those teeth and take away a little bit of the enamel and the tooth structure to make space for these porcelain ceramic veneers. They are a lot like, if you remember press-on nails, those type of things, that's a lot like what a veneer is. It fits right over what's there, okay? And so ours are designed very precisely using some rubbery textured material, and it captures with very, very precise accuracy all the parts of that tooth that we prepared, so that gets sent into the lab and they are able to make a model of it, a 3D model of everything, and fabricate those porcelain ceramic veneers. And we can manage the shape of the teeth, the shade of the teeth. We can change the color variation within the teeth to make them appear more natural. And that's exactly what we got.
That's so cool. When they brought me the mirror to look in, I just couldn't believe it was me. So natural looking and unbelievable.
Okay, so I want you to wear those around.
No choice. Oh, thank you.
You're welcome.
Oh, so cool.
I'm gonna get a little bit closer.
I always hated to have my picture taken, and then after this was all done, I actually had a professional shoot done, and it was really awesome. I never would have done that in my wildest dreams, you know.
Ready, 1, 2, 3, smile.
My family is all jealous. Before I had all this dental work done, I was actually called Grandma by some people, like, where's your granddaughter? And it's really my daughter. And now, after all this, I went to Myrtle Beach and I was actually carded. That was a really good feeling. Just really boosted my self-confidence and my self-esteem. I work in sales, and it's just nice to be able to smile with your customers every day. The past 2.5 years has been so well worth it. I love my new smile, and a big thanks to Dr. Tim and Dr. John from Chips Dental.